right, we are in the training center today with this lovely patient. We're just going to do some standard tox treatment. So we're using neurotoxin to relax this patient's muscles. Our main focus is going to be frontalis, glabella, and crow's feet. She gets a really baby dose, but it works really well for her, so we're not going to mess with it. I'm going to go through marking up, so I'm going to have you raise your eyebrows. Good, we have some movement there, of course, and relax, and raise, and relax. So I'm marking lateral border to lateral border. I'm staying about a finger width above the brow to be sure not to drop those brows at all. And I want to be sure to get good coverage of this entire muscle. So that's kind of why I'm making the dots where I am. Go ahead and raise and relax. There we have good coverage of that whole muscle. Go ahead and make an angry face. Good, and relax. Right here I'm treating the glabella, so the procerus right in the middle, medial and lateral heads of each corrugator, and that's what gives people those stubborn 11s. This patient has no static creases there. She is, has a stronger muscle there, but we do treat it relatively lowly, dose-wise. Turn towards me a little bit. Smile real big and relax. Crow's feet, I'm feeling the edge of that orbital rim, about a finger width away, and I'm following the muscle, so smile real big. You can see that my injection points are going to be right in the meat of that muscle. Go ahead and relax and turn. Smile real big and relax. Feeling the edge of the orbital rim, Same thing over here. Staying tight to that eye, not too close, but tight so that we don't hit any other muscles. All right, so now that she's all marked up, and I should have said prior, she is nice and clean. We made sure of that before I marked her up. Excuse me, I was just counting my dots. I am going to add a little bit of saline to my neurotoxin just so that I get a little bit more spread. We like to think of saline as kind of a vehicle to help the product spread a little bit further. So that's why we use it. And I'm going to go ahead and start injecting. So a little bit of a poke, okay? I'm holding that skin a little bit taut. She is youthful and has nice skin. You can tell she takes care of it. So it's a little trickier to get into the muscle, but no big deal. If I meet any resistance, I will just back up or go a little bit further. Usually just means that we're a little too deep or a little too superficial. Doing okay? All right, turn towards me. You're doing great. You're almost done. Couple more. Now, this patient knows that for 4 hours following treatment, she's not going to lay down, sweat, or touch her face, and she will be good to go. Moving on to the glabella, I like to kind of brace myself on her face and straight in, little poke. Here, I'm sealing off that orbital rim nice and tight so that I don't leak any of this product. And I'm not going full needle depth because I don't want that product to go into the frontalis, which runs behind each corrugator. Giving a little extra support here so that we are sure we're sealed off. Injecting up and away. And I am using a Comfort Tox syringe. It's a 0.5 syringe, multi-beveled. It's 31 gauge, 8 millimeters. And once you use these, you will not want to use anything else. They are really nice syringes. I'm going to have you turn towards me. If patients bruise from neurotoxin, this is typically the area because as you can see, we have some vasculature right here. I'm going to do my best to avoid it. A little poke. Very superficial injection. And as long as you are injecting safely, you want to inject as quickly, get in and get out as quickly as possible while maintaining safety, of course. Holding this taut. You're doing great. One more. And you're done. I'm going to clean this patient off and she'll be on her way.